So eighth thumb deformity is what you see in the case of the median nerve, is what you need to basically remember. Can give a slight volume. So it passes between flexor digitorum superficialis and the flexor digitorum profundus. You can see in the cut section, there is a flexor digitorum profundus and superficialis. Between the two passes the median nerve, is what you have to basically remember. A 54-year-old female has undergone thyroidectomy. And welcome to Jojo, Rubal, Prasanna and many more who are all online. There is a ligation of the artery which is being labeled 4. So what is this artery 4, which is supplying the superior pole of thyroid? So superior thyroid artery. So what is the important nerve that is accompanying the superior thyroid artery? Superior laryngeal nerve. So what is the typical innervation of the laryngeal muscles, doctor? So you should remember that all the muscles of the vocal cords are supplied by recurrent laryngeal, except the cricothyroid, which is being supplied by the superior laryngeal nerve, is what you have to basically remember. Rubal says, I have been waiting for your voice from long time, sir. Oh, my voice is crowded the YouTube. There are 1,000 videos in the YouTube, free, anytime. But I am also missing you all. But from this week onwards, it being a little bit rainy season, winter is starting, rainy and winter, it become easier for you to also tolerate the heat. So, we'll have many more sessions, but otherwise we have some of the wonderful teachers who had been delivering the class all the time every Sunday. And recently we came up with a mobile app called U-Medico. So please download the app. We have hundreds of mnemonics, articles, MCQs, free discussions, chatting with other friends. At least if you don't get seat in MD, you will get a good girlfriend or a boyfriend on the fine friends list in the U-Medico. So enjoy a good cohort of people. Now about 3 lakh medical students are going to download the U-Medico. It's going to become a big cohort. And we are getting a lot of medical teachers to individually come up with face-to-face and individual classes they can declare. If you also want to teach, you can say, okay, I will teach 4 hours of cardiology, and you can start a course and there will be students who will be ready to join. So we are going to do all that on the U-Medico. So above the vocal cords, it is the internal laryngeal nerve, which is a branch of the superior laryngeal nerve, and below the vocal cord, sensory supply is recurrent laryngeal nerve, which you have to basically remember. 38-year-old had a domestic violence being punched on the face, and that typically led to the development of the fluid collected in which sinus, doctor? This is maxillary sinus. At least that much if you can recognize, you are ready for joining MD radiology. Now a 56-year-old is undergoing an evaluation for the fatigue, and what do you find? There is a mass which is there in the colon. There is a mass in the colon, and whenever you have to do colectomy of the descending colon, then what is the vessel that you need to basically ligate? Inferior mesenteric artery is the arterial supply of the descending colon, is what you have to identify. A 32-year-old typically had a stab injury in the point which is being labeled 4, which is parasternal, 4th intercostal space on the left side. So what is the structure that most have been injured? What is the most anterior chamber in the 4 chambers of the heart? Always right-sided chambers are anterior, left-sided chambers are posterior. That's the reason when left atrial enlargement is there, it will enlarge posteriorly and it will go and compress the esophagus. That's what you have to basically remember. 52-year-old has gone to Colombo and complaints of cramping with abdominal pain, with abdominal distension. The abdominal X-ray has been shown. What do you find? There is a gas which is seen in the biliary tree. So if there is a gas in the biliary tree, how does the gas enter into biliary tree? Whenever there is any gallstone, it has passed through the biliary tree, it will pass to the ampulla of water, and it will pass into the intestine, and typically the point of obstruction is at the ileocecal junction. So ileum is the place where gallstone goes and impacts, is what you need to basically remember. 68-year-old is having progressive dyspnea and she also complains of occasional dysphagia. So her right anterior oblique view, what is it showing? Typically it is showing the enlargement of the heart which is compressing the esophagus, which is seen through the barium. So that is the reason the structure which is enlarged is left atrium. Typically patients who have mitral stenosis, tight mitral stenosis lead to increased pressure inside the left atrium because blood cannot enter into left ventricle. That lead to left atrial enlargement, and that enlargement at one point of time will lead to compression of the esophagus. So dysphagia can sometimes be the presentation of severe cases of mitral stenosis, is what you have to basically remember. 45-year-old had road traffic accident and he is diagnosed with left hemithorax, hemothorax and a pelvic fracture. And when you pass it the Foley, it is not producing the urine. So typically where is the injury? Urethra is divided into anterior urethra and posterior urethra. So typically it is the posterior urethra which has a prostatic urethra and membranous urethra. If there is any injury there, if you pass Foley, obviously it cannot enter into bladder. So how can it drain? It can't drain. So that is the reason the injury is in the posterior urethra. So basically what is the histology is a favorite question. Anterior urethra is all supplied by pseudo-stratified columnar epithelium. You will remember me in exam hall. Favorite MCQ in histology. Every exam they will ask this. And the distal portion of the anterior urethra, that is the place where the fossa navicularis is located towards the glands, it is squamous epithelium. Then if you look at posterior urethra, it is similar to bladder. It is ultimately connecting with bladder. So bladder has transitional epithelium. So there is a reason transitional columnar epithelium is the one which is the lining of the posterior urethra, is what you have to basically remember. A 23-year-old patient is complaining of right-handed clumsiness. What is called musician's nerve? Ulnar. Laborer's nerve? Median, because the coarse movements of the hand are because of median nerve. Fine movements like playing veena is all because of ulnar nerve. So what he is having is basically clawing. So typically, what is the common location where ulnar nerve get injured? Hook of the hamate is the typical location, is what you need to remember. Now 63-year-old is having a sudden onset of shortness of breath and evaluation has shown pulmonary embolism. So what is the typical place where you place the filter to prevent recurrences? Classically we put IVC filter. So the challenge is, how will you recognize IVC on MRI? Is the question. So out of these structures, this is the vena cava, this is the aorta, this is the renal vein, and this is the renal artery. So this is the typical MRI structure. Vein versus artery, you need to differentiate and you need to know which is more medial and more lateral. 48-year-old is having vague chest pain and his FDA ABS is positive, that is he had syphilitic aortitis. That is the reason that lead to development of aortic aneurysm at the root of the aorta, leading to aortic regurgitation. So what is the underlying pathophysiology? Fundamentally the vasa vasorum undergoes arteriolitis, leading to obliteration, leading to ischemia of the wall of the aorta, and that lead to weakening and dilatation, and that lead to regurgitation. So syphilitic aortitis is due to vasa vasorum's obliteration is what you have to basically remember. Now 72-year-old has persistent headache and difficulty in chewing, and arterial biopsy is being shown, and immediate prednisolone therapy is being initiated. So it's all a story of giant cell arteritis. You don't need to look at the face of the histological slide also. Sometimes history is the thumb, doctor. Even tomorrow also when you are practicing, patient when he comes and talks to you, closing your eyes you must tell diagnosis. The moment you reach that intuitional stage, that is the time you are called consultant, right? Saying is easy, but that stage will hardly exist. But definitely 85 to 90% of clue should come from history. 4 to 5% will come with physical examination, स्टेथ लगाने से. मगर पेशेंट को 90% सेटिस्फैक्शन स्टेथ लगाने से मिलता. अरे डॉक्टर साहब ने कुछ जॉइंट्स का टेस्ट किया, थोड़ा लिवर देखा, स्प्लीन देखा. All that you have to do, but 90% you must know. Okay, 1, 2, 3, 4 is the checklist. Possible problem of the patient. Let me bottle down it. You have to have that betting spirit in the mind. This could be this, 2, 3, 4. 4 possibilities. 1 and 2 is most likely, and this investigation should bring out the result. So, blindness can occur with giant cell arteritis if it is not being treated on time, is what you need to remember. 56-year-old male with acute and severe chest pain is found to have an abnormal thoracic MRI. Is this diagram given, or next questions diagram was given? No, that was a wrong diagram. Actually, there is an aortic aneurysm. So, what is the cause of aortic aneurysm? One of the causes is hypertension is a predisposing factor for a dissecting aortic aneurysm. 56-year-old, history of breast cancer, treated for radical mastectomy, typically developed lymphedema. Lymphedema post-mastectomy is a risk factor for lymphangiosarcoma. A 34-year-old has got a fever, weight loss, myalgia, abdominal pain, and blood pressure is 160/90. Then typical imaging findings are, what is this called? Libido reticularis. So, presence of libido reticularis with hypertension, with fever, with weight loss, with myalgia, with abdominal pain, typically points the diagnosis towards polyarteritis nodosa, vasculitis. So, typically the pulmonary vessels are spared from involving in the pan is what you need to basically remember. 46-year-old is having severe headache, and his blood pressure is 230/140 and heart rate is 90, and papilledema is being shown on fundoscopy. So, typically what is most likely condition that may be found on histopathology is the question. Onion skinning, onion like layered lesions are a feature of arteriosclerosis. So, you have two types, one is hyaline, other is hyperplastic. Hyaline typically is seen with benign hypertension, and hyperplastic arteriolitis is seen in the case of the malignant hypertension. So, onion skinning is a typical feature that you see just like the onion skin in case of significant hypertension. 48-year-old male presented with abdominal pain. Typically tumor cells are positive for CD31 cell marker, and the histological slide has been shown. Then what is it most likely? So, fundamentally CD markers is a important area for the examiner. List of CD markers, you have to mug it. Your forefathers who took MD entrance also mugged it. That's how they got seat into MD and became assistant professors, associate professors. Some of them even became professors. 1985 se entrance hai. This is almost 2016, means last 30 years there is a history of an entrance exam being conducted, right? So, since then, this is a favorite question. So, liver angiosarcoma is the typical histology and CD marker. 72-year-old has chewing difficulty, persistent headache, artery biopsy is being shown. So, this is a classical case of what? Giant cell arteritis. Similar to giant cell arteritis, where else do you find vasculitis? So, vasculitis is divided into large vessel vasculitis, medium size vasculitis, small vessel vasculitis. So, giant cell arteritis is an example of a large vessel vasculitis. Takayasu arteritis also aortitis. So, large vessel vasculitis. That is the reason Takayasu's arteritis. So, how will you remember Takayasu arteritis? Giant cell, Takayasu are both large vessel. Then medium vessel is polyarteritis nodosa and Kawasaki. Kawasaki is a bike. Bike is not as small as a cycle or as big as a car. So that is the reason Kawasaki is a medium sized vasculitis is what you can remember. Some stupid way of remembering. And all the remaining things are all fall under small vessel vasculitis. Okay. Then once more in vasculitis you will divide it into quasi-immune or immune complex mediated. They are all the vasculitis is one topic you have to be fully strong when you go to the exam. So what is the pathological lesion of a patient who has got myocardial infarction, claudication of the lower limbs, decreased sexual performance, and he has undergone carotid endarterectomy? Carotid endarterectomy, why will you do? Whenever there is a stenosis, significant stenosis, more than 70%. So what is the underlying cause generally for all these things? Claudication, decreased sexual performance, everything. It is because of the accumulation of the fat. Atherosclerosis is the underlying cause. So, lipid filled intimal plaque is the underlying histopathology. A newborn is born with the lesion which is being shown. So, what is this hemangioma? You should recognize first. Strawberry hemangioma. So, hemangiomas are divided into capillary hemangiomas and cavernous hemangiomas. Capillary hemangioma is basically strawberry type of hemangioma, and they can be multiple. They grow rapidly in first few months and they begin to fade between 1 to 3 and they will regress by the age of 7. So, this being a strawberry hemangioma, you should tell the parent that don't worry, by the time he goes to his LKG, UKG, first class, by the time it will regress, that's what you have to tell the parent. Whereas cavernous hemangiomas, they are locally destructive, they won't regress, and the von Hippel-Lindau's disease-like conditions. You have cavernous hemangioma which is located in the retina, in the brain, in the spinal cord, along with the cystic lesions in the pancreas and liver. That's called von Hippel-Lindau is what you need to basically remember. 72-year-old is having a vague abdominal discomfort and imaging is being shown to you. And what is the underlying cause for this condition? So, what you are seeing here, you are seeing a abdominal aneurysm fundamentally. And underlying cause of the aneurysm is always atherosclerosis. So, a intimal streak. In fact, after 60, if you get the imaging done, a good number of people will have a abdominal aortic aneurysm. Most of the times patients are asymptomatic. If a question is asked, what is the common way by which a aortic aneurysm is being detected? You will do ultrasound for some other reason in an asymptomatic patient and you will discover an aortic aneurysm. That is the most common presentation. Asymptomatic guy, nothing is there. Of course, hypertension history will be there. And you coincidentally find an aortic aneurysm. Nothing need to be done. Unless the size is alarmingly bad. So once more you need to review clinical management based on what size you like to operate, you don't want to intervene, etc., etc. Now the arterial biopsy is being shown. So what is a pathological condition to which there is a predisposition in this given condition? So fundamentally there is a cystic medial necrosis with myxomatous degeneration is the typical histology, and myxomatous degeneration is a predisposing factor for a dissecting hematoma is what you have to basically understand. Now the skin biopsy is being taken from a child who has got vascular lesions with IgA and C3 deposition. So what is the most likely presentation of this case? So typically IgA nephropathy, Henoch-Schönlein's purpura. They both are called two ends of the same spectrum of the clinical condition. Henoch-Schönlein's purpura and IgA nephropathy. So that is the reason, what is the presentation of Henoch-Schönlein's purpura? They will have a skin rash and they will have abdominal pain. Why will they have abdominal pain? Henoch-Schönlein purpura is IgA nephropathy or two ends of the spectrum. So in Henoch-Schönlein purpura, it is a small vessel vasculitis and that involves mesenteric vessels that lead to intestinal ischemia and that lead to development of a severe abdominal pain. So abdominal pain and the presence of the vasculitic purpurae in a child, typically buttocks is the area where you find the presence of the purpuric lesions of the Henoch-Schönlein's purpura is what you need to basically remember. 45-year-old is being hospitalized with fever, weight loss, muscle pain. He visited the emergency room several weeks ago for dark stools and malaise. Muscle biopsy is being shown and this patient's condition is associated with what? So fundamentally, fever, weight loss, muscle pain along with dark stools, malaise, a diffuse phenomena. Whenever a diffuse phenomena is there, you should think of vasculitis as underlying cause. So it is a case of polyarteritis nodosa. Hepatitis B infection is associated with the polyarteritis nodosa is what you have to basically remember. Then 38-year-old asthmatic develops a wrist drop. Wrist drop means radial nerve injury. Eosinophil count is high and you find a lot of eosinophils in the histology. So anybody with recurrent asthma-like presentation, what is the vasculitis that comes to your mind? Church-Strauss syndrome is what you need to basically remember. Church-Strauss syndrome. So granulomas, asthma, fever, eosinophilia. So this combination is what you basically call Church-Strauss syndrome. 63-year-old with knee replacement surgery has popped off and after the death, when the autopsy is being done, it is being found. What do you see? Pulmonary embolus. So what would have prevented? Giving low dose heparin. So though the patient undergoes surgery, especially orthopedic surgeons need to remember. Some of you are aspiring to be orthopedic surgeons. And last week or week, lot of our students called, sir, I got MS ortho, I got MD gynocs, I was feeling little guilt. Last 6-7 months I was not teaching much. Lot of our other teachers are teaching. But finally they give a credit. I said, wonderful teachers and they also made a good hard work. Focused preparation, doctor. You should read 20% and get 80% score. The moment you know what is the trick of the trade, every entrance you go, you will crack it. If you didn't get that fine point how to play a spin ball of the examiner, Hard work you do, catch out, run out, catch out, run out, every entrance exam. So you must know to play. So, low dose heparin. Orthopedic surgeons, lot of times when they do hip surgery, etc., that is a prolonged immobilization. You see one case of hip surgery, post-operatively, how much immobilization will be there? That immediately precipitates a thrombus and overnight embolism. That's the reason low dose heparin should be started. You should not worry, hurry, post-operative patient, there will be bleeding and all that. No, nothing to worry. You can give low dose heparin confidently and avoid the development of the pulmonary embolism. A 40-year-old with red skin lesions on his back, what is the most likely diagnosis of this case? It's a spotter. So, cherry hemangiomas they are called as. Nothing need to be done. They are also called Campbell-De Morgan spots. Cherry hemangiomas. Shortly we are coming up with online mock tests even available on the UMedico app. So, it become easy. Another good thing is results. Suppose after you finished the test, right? Another 1000 people took the test. Every question you can click and see what is your answer. How many answered A, how many answered B, C and D. You click on A, then all guys who answered A will come, including what is their rank. You click on the guy, you can start chatting with that guy to discuss about that question. Why did you answer A? I too thought it as A. So, it's like a Facebook plus online. Facebook plus mock test. Facebook plus WhatsApp plus mock test kind of feature. Suddenly somebody in Srinagar answered it as A and you are from Trivandrum and you answered A. Right? So, many things can happen across coffee, they say, no? Like that many things can happen across the MCQs. Right? So, 28-year-old male. So that is the reason whenever we used to not get a seat and big rank, 4 or 5 days there used to be depression. Later on once more go to reading room, fresh faces will start coming to the reading room because all our friends got the seat. So fresh faces means fresh energy, fresh into. So ultimately when we get the seat it's a shock. Oh, no more this happiness of being with a group of guys and girls and have a little fun and prepare for exam MCQs and show your knowledge, their knowledge, etc. So, this is the happiest time of life, enjoy it. After this, you have to run around. 28-year-old male, PTA, PTT normal. That means there is no coagulation cascade disorder. But still you find petechial bleeds, which is very classical feature of Osler-Weber-Rendu's syndrome, where there is a big hemangiomas with thrombocytopenia leading to development of bleeding episodes along with telangiectasis. 47-year-old with recent onset of oliguria, high serum creatinine level, recurrent intranasal ulcers, history of hemoptysis. Hemoptysis is lower respiratory tract involvement with cavity lesion. Recurrent intranasal ulcers means upper respiratory involvement. Along with high creatinine means renal involvement. Upper respiratory, lower respiratory with renal involvement is equal to, close the eyes also you should say, Wegener's granulomatosis. You don't need the histology otherwise. It's more confusing to see histology and discover. But still, so what is Wegener's granulomatosis? ANCA positivity, anti-neutrophil cytoplasmic antibodies. So antibodies in Wegener's are directed against what? Neutrophils is what you have to basically remember. 76-year-old with headaches, with recent vision deterioration, started on prednisolone and improved significantly. Finish. What is the only condition? He is talking about giant cell arthritis. So histology is showing giant cell arthritis. So how do you describe giant cell arthritis? It is a granulomatous inflammation of the media of the large vessel is equal to giant cell arthritis. Autopsy in a 65-year-old is found to have narrowing of the renal arterioles and histology is being shown. What is the possibility that the patient suffered from? So fundamentally, whenever there is any diabetes, it leads to development of hyaline arteriosclerosis. So that can sometimes lead to renal artery stenosis also. So when do you suspect a secondary hypertension, doctor? Any hypertension above the age of 50. Because of the atherosclerosis, renal artery can undergo stenosis, then patients can develop hypertension. Any hypertension below the age of 30, there can be pheochromocytoma, there can be Cushing syndrome, there can be fibromuscular dysplasia. Any of these entities are below the age of 30. Between 30 to 50 is called essential hypertension, which generally will not have any underlying cause. Then 28-year-old is typically having an extremely tender lesion. And what is the origin of this lesion? So typically the cells of the glomus tumor, their original function is thermoregulation. So that is what you need to appreciate. A 62-year-old is having recurrent episodes of the lesions which is being shown. This is a typical thrombophlebitic lesion which is painful. So recurrent thrombophlebitis is basically a sign of internal malignancy of a visceral cancer, typically a pancreatic cancer, is what need to be remembered. Now, one of the hyperlipidemias is because of a genetic mutation in the process that is being shown. So LDL receptors, lower expression of the LDL receptors is the underlying cause of type 2A type of hyperlipidemia. So you must be sure, doctor, all hyperlipidemias, Fredrickson's classification, where do you find chylomicrons elevated type 1? LDL in case of type 2A, both LDL, VLDL type 2B, IDL in type 3, VLDL in type 4, VLDL and chylomicrons in type 5. Similarly, where do you find eruptive xanthomas? Where do you find pancreatitis? Where do you find that supernatant on centrifugation, a milky turbid supernatant on centrifugation when chylomicrodemia is there? So all that hyperlipidemia funda, you have to be 100% sure. No excuse. These are all inevitable topics, right? So you should be like an all-rounder, both batting and bowling. You can't say I am very good in pathology. Oh, biochemistry I am not good at. I hate forensic smell. Oh, you have to smell, lick every aspect of 19 subjects. Be ready to say that I love it. I have an appetite for it. I have got I have a joy in reading it. At least for a short time, you have to impose your, especially SPM like subjects. You have to read means first you should have a lot of hype. You need to do a bit of skipping, 200 skips, and say I'm good in SPM. I love those grains. I love the proteins. I love NPU. I love mosquitoes. I love insecticides, and then go to the reading room. Otherwise, if you say I'm that intellectual guy who only can read Harrison but not the Park SPM, no, you'll be parked forever in reading room, right? So poor receptor expression, typically in which organ is responsible for type 2A? It is in the liver. In the liver, it is the LDL receptor expression which is poor is the underlying problem. 44-year-old woman presents for a routine checkup and physical examination findings, arcus senilis, xanthelasma are being shown. So where do you, it is a underlying cause is hyperlipidemia, underlying diabetes. There is an infective endocarditis found with Staphylococcus aureus. Remember me, doctor, morning session, evening session, whichever session you booked for NEET PG, doesn't matter. Infective endocarditis is an invariable component of every session, right? So 34-year-old who is an IV drug abuser, Staph aureus, classical lesion. That's what you need to remember. A 63-year-old army officer died in the car on his way to emergency room 30 minutes after the onset of chest pain. A cross section of his coronary artery is showing occlusion. So what is the most underlying problem that might have popped him off so fast? Most common cause of the death in case of the MI is ventricular fibrillation, is what you have to basically appreciate. Now a 38-year-old typically comes to the emergency department with high grade fever, dyspnea, fatigue and auscultation shows early diastolic murmur. In the neo-aortic area, typically suggestive of aortic regurgitation. So aortic regurgitation with the background of high grade fever is infective endocarditis once more. So what you are seeing here is splinter hemorrhages. So splinter hemorrhages underlying phenomena is embolic episodes, right? So you must know Osler's nodes are because of what? Then JNWA lesions are because of what? Which are painful, which are painless between Osler node and JNWA? Oslers are painful, JNWA are painless. In gynecology we call painful os. So Osler's nodes are painful, easy to remember. JNWA lesions are painless. Don't say Dr. Murali Bharadwaj teach like that, but some ways to remember. There will be at least some 200 to 300 lists to remember, doctor. Some stupid lists. What are the 5 complement components that are chemotactic in nature, right? What are the P450 inducers, P450 inhibitors? Or list pocket mein rehna, right? Splinter hemorrhages are non-specific, non-blanching, linear reddish brown lesions. They usually do not extend across the entire length of the nail. They are the few things to remember. Now a 52-year-old comes to emergency department with a central chest pain and ECG is being shown. What do you see in ECG? ST segment elevation significantly. ST segment elevation MI, STEMI, whenever it is there, what is the treatment, doctor? Typically, you need to do reperfusion. Coronary reperfusion can be done either with a thrombolytic agent or with angioplasty. When you have a option of primary coronary angioplasty, that becomes a definitive treatment of STEMI. That is an indication. Now, 58-year-old with pain and tingling in the arm. On examination, both pulses are palpable in the upper limbs and chest X-ray is abnormal and aortography was performed. Whenever he is lifting the limb, the blood flow is stopping. This side blood flow, when arm is low, it is fine. When lifting, diminished. Classical of cervical rib. So left cervical rib is what is the underlying diagnosis. Now 32-year-old typically has a 6 months history of weight loss. Hemoglobin is 9, MCV is decreased and anti-endomysial antibodies are absent, but IgA is typically deficient, less than 0.1. And what is the endoscopy showing? Endoscopy is typically showing a cracked mud appearance. Pot is there now? Inside the pot, cracked mud appearance. That's what you have to imagine in this endoscopic appearance. Whenever villous atrophy is there, in case of celiac disease, you have got a typical appearance which is classical of celiac disease, where IgA is typically deficient. A 46-year-old, history of asthma and urine analysis is showing positivity for the blood and protein is also positive. Eosinophils are typically elevated with ESR being 38. HRCT is showing the presence of involvement of the lung. So this is all classical of eosinophilic involvement of the lung is which vasculitis? Church-Strauss. So classical of Church-Strauss syndrome. So past history of asthma with eosinophilia with rapidly progressive glomerulonephritis is typical diagnosis of Church-Strauss syndrome is what you have to basically remember. Now doctor, 48-year-old presented with impotence, testosterone level is low, also has insulin dependent diabetes, and he is having joint pains, arthritis, and liver is showing a increased attenuation. So they are all the features which are suggestive of idiopathic hemochromatosis, which is diagnosed by getting the serum ferritin levels which are alarmingly elevated, is a typical feature which you see in case of the idiopathic hemochromatosis. 34-year-old is investigated and found to have abnormal liver function. And if you look at AST, ALT and alkaline phosphatase is significantly elevated compared to the elevation of AST, ALT. So whenever alkaline phosphatase is more significantly elevated, it is a sign of cholestatic picture. So there is a cholestasis which is being found. His MRCP and ERCP is showing chain of lake like appearance, which is typical feature which you see in case of primary sclerosing cholangitis, which has a cholestatic picture with a chain of lake appearance on ERCP and MRCP is what you have to basically remember. Now doctor, 26-year-old with jaundice had taken excessive amount of paracetamol and alcohol after argument with the husband. So what is the best marker? Any given day PT is the best marker of prognosis whenever there is any paracetamol overdose and poisoning with acute fulminant hepatic failure is what you have to basically remember. A 16-year-old girl has presented 6 courses of chemotherapy followed by bone marrow transplantation, followed by cyclophosphamide treatment, and typically what you are finding in the lung on HRCT, fibrosis. So it is a classical case of cyclophosphamide induced lung fibrosis. So what are the list of drugs that lead to development of lung fibrosis, doctor? Busulfan, methotrexate, methotrexate, allopurinol, nitrofurantoin, minocycline. So all these you have to remember like a parrot in the tomorrow's exam. 24-year-old is admitted, road traffic accident, severe head injury. After that he developed hyponatremia. But the urea and creatinine are normal and there is no thyroid dysfunction or there is no adrenal dysfunction. So what is the criteria for you to call SIADH? SIADH is hyponatremia in the absence of liver dysfunction, adrenal dysfunction or thyroid dysfunction. It is called diagnosis of exclusion, and head injury is the predisposing factor for syndrome of inappropriate antidiuretic hormone. So remember, SIADH is a diagnosis of exclusion. If there is a hyponatremia in a patient of hypothyroidism, if there is a hyponatremia in a patient of renal failure, if there is a hyponatremia in a patient who has got a liver dysfunction like cirrhosis, then that is not called SIADH. You call it as SIADH only in the absence of liver dysfunction, adrenal dysfunction, thyroid dysfunction, and in the absence of Edison or Cushing, then only you call it as SIADH. 44-year-old with heart failure, his medication consists of ramipril, aspirin, carvedilol, furosemide, and he has a heart rate of 70, blood pressure of 100, and the radiograph is shown, and his main problem is dry cough. What is radiograph showing? Typically it is showing dilated cardiomyopathy with an enlarged cardiac shadow. So doctor, I am very happy to see 13 plus online viewers. Locitin, substitute ramipril with locitin. Locitin is ARB, angiotensin receptor blocker, which will not have dry cough. Ramipril is ACE inhibitor, which is the underlying cause. Now, a 64-year-old male, retired lieutenant colonel, coronary angiogram shows 80% of stenosis in the proximal aspect of the lad, and he was successfully treated with coronary artery stent. And now, which of the drugs introduced in a patient of coronary artery disease improve the long-term prognosis? Typically, ACE inhibitors have that ability. Neither the beta blockers nor the nitrates have effect on the long-term prognosis. But if you introduce a ACE inhibitor, it is known to alter the remodeling of the heart. So that's the reason every patient getting discharged under your care from the coronary ICU, coronary unit, introduce ACE inhibitor and give him a long-term advantage is what you have to remember. Huh? Sorry? It reduces the mortality. Long-term reduces the mortality, ACE inhibitor. That is called HOPE trial, Heart Outcomes Prevention Evaluation Study. HOPE trial has shown the introduction of the ACE inhibitor in the population who has a cardiovascular event, especially with left ventricular dysfunction. There is a Zami Asman Farak if you introduce ACE inhibitor. Now, 64-year-old obese, right-sided deep venous thrombosis, history was there, a thrombotic episode, history was there. And he has aquagenic pruritus. Whenever he takes a shower, he gets pruritus. बीबी बोलते हैं कि प्यूरिटिस कम करने के लिए कोई आदमी शवर लेता है, आपको तो शवर लिए तो प्यूरिटिस आता है, ये थोड़ा रिवर्स में जा रहे हैं, क्यों? Hemoglobin is high and urate values are high. So that, urate is normal. Sometimes pruritus can be explained with hyperuricemia. And he has got that reddish appearance, which is all suggestive of polycythemia rubra vera, is what you have to basically remember. Now, ECG is being shown in a 14-year-old boy. What do you find? In the lead V1, you are finding prominent QRS. Normally QRS kahan prominent hota hai? From V1, V2, V3, V4, V5, V6 aane ke baad R wave should be prominent. In lead V1, V1 is a right-sided lead. Our electrical axis is passing from right towards left. So right-sided V1 को छोड़ के V6 which is the left-sided lead की तरफ जा रहा है हमारा left axis. I mean normal electrical axis. So obviously a positive wave, that is a R wave, should come in the left-sided leads normally, not in the right-sided lead. But when will right-sided lead will show? V1 will show a prominent R wave if the axis is shifted towards right side. So what makes the axis to shift to right side? First of all, why the axis normally is towards left? Because our left ventricle is thick. If the right ventricle becomes thick, then the axis shifts towards right side. And what is another proof to say there is a right axis deviation? In the lead 1, the QRS is looking down. In lead 3, the QRS is looking up. They are looking right towards each other. How will you recognize? Normal axis kaise rehta? Lead 1, QRS look up. Lead 3, QRS look up. लड़का ऊपर देख रहे हैं, लड़की भी ऊपर देख रहे हैं. क्या हो रहा है? शादी हो रहा है, दोनों किसको देख रहे हैं? At the time of marriage, both are looking up towards which nakshatra? अरुंधति नक्षत्र. दोनों ऊपर देख रहे, नॉर्मल होता है. मेम साहब नीचे देख रहे और साहब ऊपर देख रहे. If the husband is turned that side and the wife is turned this side on the bed, means they are no more in love with each other. They are ready for divorce. They are left axis deviation. Lead 1 up, lead 3 down. The QRS complex, left axis. Lead 1 down. If the lead 1 QRS is down, looking down, lead 3 QRS is looking up, they are looking right towards each other. That is called right axis deviation. Summarize? Easy way. QRS is up, lead 1. QRS is up in lead 3. दोनों ऊपर देख रहे, normal. QRS is down in lead 1. QRS is looking up in lead 3. They both are looking towards each other, right axis deviation. QRS is up in lead 1 and QRS is looking down in lead 3. They left each other, left axis deviation. Okay, simple way to remember. So, what is the cause for a prominent QRS in lead V1 and the presence of a right axis deviation? What is the underlying cause? Typically, some pathology on the right side, which is typically pulmonary stenosis, is what you have to basically remember. Now, a 21-year-old with a infrascapular area sharp pain, reduced entry into the left lung base, oxygen saturation is 96%. But what do you find? Small pneumothorax. If the pneumothorax is small, nothing need to be worried. You can give oxygen inhalation and repeat the radiograph. So, that is a British Thoracic Society recommendation. Depending upon the size of the pneumothorax, how do you want to treat? I leave the literature for you. Then 46-year-old with malaise joint pains, paracetamol he takes sometimes, hepatomegaly is there, decreased sensation in the hands and feet is there, and what is the underlying diagnosis? So, there is a Raynaud's phenomena, physical examination, and there are also purpuric lesions. So, all this put together, typically it is a case of polyarteritis nodosa. So, it's a case of cryoglobulinemia. So, cryoglobulinemia has a hypercomplementemia along with the Raynaud's phenomena is what you have to basically remember. Then 34-year-old gone to Thailand frequently and now presents with ulcers in the mouth which are very painful with edematous pharynx, is a classical case of acute HIV infection. 64-year-old with rheumatoid arthritis is typically taking penicillamine and now she is having proteinuria with albumin being only 2.6 with a pitting fetal edema. So, classically stop penicillamine is the best way to tell her. Otherwise, it is a case of drug-induced membranous glomerulopathy leading to development of proteinuria. 59-year-old MRI scan is showing the presence of a metastasis to the spine, and that led to development of paraplegia. MRI is confirming metastatic spinal cord compression. 16-year-old, typically you are finding purpuric lesions on the leg. Abdominal cramps are there in the history with the weight loss with erythema nodosum, which is being shown. Erythema nodosum is typically shown in the picture, and this points towards inflammatory bowel disease with erythema nodosum along with abdominal cramps and weight loss. Now 24-year-old with acute asthma, oxygen saturation is typically low and he needed ventilation. Then he had epileptic seizures. So can there be a drug-induced seizures among the asthma drugs? Which one can lead to it? Theophylline. Toxicity can be the underlying cause. So that brings us to the end of all the image-based questions, doctor. So finally, when you go to the exam, if you get the clue, that makes you to answer. All image-based questions are easy to crack, provided you know what is the clinical vignette is all about, what examiner is looking for. Then at spinal cord level, you should be able to answer. Okay. So thanks for a patient listening, and we'll once more catch up on the next Sunday, every Sunday with a discussion. Thank you.